Okay, it looks like everyone's out of the waiting room.
Okay. We'll make sure everyone had a second to connect. Looks like they have. Well, TGIF, everybody. I'm wearing a hat that was more suitable for Monday, which is May 4th. May the 4th be with you, is what everyone was saying. So Darth Vader, cute, but it creates an echo in my ear, so we can't do that. So welcome to our weekly meeting. You'll see, for those of you who were able to look at the slides before we have them up on the wall, for those of you who have access, for those of you who can only call in, we send those embedded in the invitation now. So you have both the access to our meeting as well as a link to the slides. So this is basically just reminding all of us that we're sort of in a different place, each of us, and can probably describe our emotions with one of the emojis. You'll be happy to know that Facebook has a new one that is care. So the world continues to go on, and we continue to care for one another and the people that we serve. And so we thank you for joining us, and really, again, support you and applaud you for all the work that you do Monday through Friday for the world. So we've incorporated into our time a moment of silence, just remembering that we've lost people to this pandemic, that there are loved ones that are fighting to stay alive, and that our clients are most at risk. And so we just ask that you join me for a moment of silence now. Okay, thank you. For those of you who haven't been with us before, we follow a set agenda, which is the next slide. We have our partners checking in, and then we have an on-ground strategy. Today, we've got Linda from CCADV talking to us about assessing or responding to domestic violence during the crisis. What we've also determined is we try to pack a lot in to 1 hour, and so you'll see on the next slide that under announcements, that we're actually going to break it up and do an alternate format, so that 1 week we have an on-the-ground strategy, and then the next week we allow more time for updates from our CT BOS partners, just so that we're not cramming 2 hours worth of work into 1 hour. I would remind you that throughout this presentation that you take a moment to breathe, to stretch, to make funny faces in your camera for us, that we want to keep this light and not fun, but supportive as much as we can. So a reminder that we post all of the responses from the previous weeks at a link. You can always contact us, and there's a chat box at the bottom of your screen, so you can ask questions in real life time, and we'll monitor that. One announcement that I want to give to you verbally is that next week we do have our regular steering committee meeting, and that will happen at 12:30. So this week we moved it to 12. For this call, we'll be back at our regularly scheduled channel at 11 o'clock, allow for a little bit of break, and then at 12:30 have our steering committee meeting. So you'll be with us for a little bit longer next Friday than normally, but you won't want to miss it. Okay, so next slide, want to talk to people and remind folks about the SNAP program. And does somebody feel like they need to sort of walk us through this? Suzanne, if you want to, you've got to unmute. Suzanne, if you want to, you've got to unmute yourself, darling. Still can't hear you, Suzanne.
Trying, sorry. I trying new things with Zoom, and then, you know, then you have trouble. So don't try new things. So these are slides. Last week we had a presentation from DSS that was chock-a-block full of information. And what Liz did was try to capture some of that information that we went through on slides for people, so they have them for reference. So it talks about the extension of eligibility, additional SNAP benefits where people are going to get the maximum allowed. Also talks about suspension of the interviews, and also planning for online access to food with SNAP's benefits. So keep posted, check out that DSS website. And then also some information about the Husky program, which applies to probably some of the families that you're working with, and extensions of benefits and availability of testing. So we did hear this last week, but now you have the information on slides to share with your team.
Great, thank you. Right, so a reminder that we're not going to have people read slides to you. We're presenting them to you. Everything is being archived. These calls are being recorded. And so you can always check back with us. So if you're like, whoa, 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 you went too fast over that slide, fear not, you've got them in your inbox even as we speak. So our update with our partners, somebody from DOH.
Yep, this is Lee. So right now, I think we are starting to make the pivot to talk about housing people out of our hotels and shelters. So there is a task force that has been kind of meeting informally of our CAN leadership, but now they are starting to pivot those conversations to talk about how we're going to rapidly exit people out of the hotels. As you guys know, we've talked about the ESG funding that has come into Connecticut. And so we are having internal conversations right now about getting that money out to all of the CANs, so we can actually start doing the housing work. And we're also looking at using some of that money for eviction prevention programs. So all of the details on that, of course, are going to be forthcoming. We know in order to utilize the ESG funding, which we're anticipating around $4 million of that will go to rapid rehousing endeavors, but that's going to also need staffing supports to come with it. So, you know, looking at both staffing as well as rental assistance dollars will be coming in the next couple of weeks. Any questions?
Feel free to type in your questions, and we'll take a break after the next two partners share updates to see if there are any questions in the box and answer them if we can. So Alice from DMHAS.
Hi, thanks everyone. Good afternoon. So I have a couple of brief updates. One, on I guess it was Tuesday, the Provider Alert 15 came out regarding personal protective equipment and how to request that from DMHAS, and also the CVS rapid testing site in New Haven. So I sent that information to Liz that can be either embedded or sent out. Also, for those of you who have not heard, I'm trying not to read directly from anything, but I just need to prompt myself that the governor announced the suspension of certain regulations to have an expansion of the COVID-19 testing. And so I can forward that out to Liz also, but essentially says that people don't need to have a prescription to get a test. Those, I already sent one out. I can send the other one out to Liz. DMHAS is looking into a possibility of applying for some very short-term funding related to crisis intervention from FEMA for folks who have been affected by the COVID-19. And so we're talking about that this afternoon. So I don't really have an update today other than that's something that is a possibility. So if there are questions or comments, as John said, after David speaks, we can go to the chat box. I also, I know that we sent out the waivers, the DMHAS waivers regarding signatures on items. So, and people have been sending me their notification that they'll be using them. So again, if you haven't sent me that notification, you can just send it. I may get back to you if I'm having a light day, but if I don't get back to you, it is just more notifying us that you will be using it rather than you need our permission. So with that, I can send it over to David. Thanks.
Great. David Gonzalez-Rice from CCEH.
Good morning. Hi, everybody. Thank you, John. Yes, I want to share a few items with you this morning. We have two webinars right around the corner. As usual, the links to register for those are in the newsletter that went out this morning. I want to call your attention to part 2, focused on infectious disease protocols, reducing transmission of COVID-19 in shelters and hotels. We have CHC Inc. and New London Homeless Hospitality Center joining us to talk about protocols that they've implemented in their respective communities. Materials from the previous webinar up on our COVID-19 resources page. And then Linda Casey will be hosting on Tuesday data changes in HMIS. Some have gone live already, others are still getting finalized. Many of these concern tracking COVID status or test results for clients to facilitate what we expect will be some options around placement going forward. A couple of things to bear in mind. So that webinar is focused on the HMIS structure and fields that will be available. And I'll remind you that we've worked with Department of Public Health to put the local health departments in touch with the CANs. The expectation that shortly, if it hasn't begun already, those health departments will be sharing COVID test results information with the CANs to be tracked in HMIS. So do give us your feedback, and Linda Casey particularly would like to know where that is not working, if you expect it to be underway. Also want to mention that the state of Connecticut, in its massive ramp up of testing and contact tracing capability, is prioritizing households experiencing homelessness. So we do expect widespread testing to come available shortly for people staying in the shelters and in the hotels. Email went out from our CEO, Richard Cho, earlier this week, announcing that some of the rapid exit money that went from DOH to CCEH, previously used for families, is now open for individuals. We know that some pots of money for that around the state have run low or empty. So agencies that currently hold an MOU with CCEH for Be Homeful or Rapid Exit don't need a new one. But if your agency serves individuals experiencing homelessness in shelter and does not have a CCEH MOU, this is your opportunity to access those dollars in the next few weeks. Guidance not to clear them. That's going out to municipalities via Connecticut Conference of Municipalities, to local health departments via DPH, and to law enforcement via the DMHAS regional coordinators. So those of you who serve people experiencing unsheltered homelessness should know, if you hear of a campsite under threat of being cleared or swept, please do reach out to Lee Shields Church, Cara Capabianca, and myself. We want to help connect those dots among all the players in local communities to come up with alternative plans where there are campsites that the local authorities perceive to be a problem for public health.
Great, thanks, David, and thanks for all that CCEH does. Keep up the good work. I hope that some of you actually enjoy a weekend, which means not working on Saturday, not working on Sunday. I think we've lost track of the thing called a weekend, but I hope that CCEH and all the folks on the ground will actually take some time this weekend and go build a snowman, because we're going to have a snowstorm. Any questions that that have arisen for our partners before we move to our on-the-ground strategy?
There are none in the chat box right now, John.
Okay. As things arise, feel free to put them in. So without further ado, I want to introduce Linda Blasi from CCADV, who's going to work with us on assessing and responding to domestic violence during this crisis. Welcome, Linda.
Oh, welcome, and thank you so much for having me today. I really appreciate this. And I will say this, this is a brief presentation that we're making today. I know that I was invited to be a part of this, this meeting today with you. So if you have any additional needs, especially now when people are working from home and stuff, we would be happy to provide some additional training or whatever it is that we can do to help you out. But today, I'm just really here to talk about, what's going on, how are we responding to intimate partner violence, and some of the issues that we see given that we have this pandemic in place right now. So let me start out, go ahead and change the slide, just by talking about what I'm talking about when I'm thinking about intimate partner violence. So I think, a lot of you are already proficient in at least the basics around intimate partner violence or domestic violence. It's a pattern of abusive relationship where one person tries to control and dominate the other. So the way that we see it manifest itself is in a number of ways, verbally, psychologically, physically, or sexually, financially, or technologically. So there's a lot that gets encompassed when we're talking about intimate partner violence. But generally what happens is that we're leaving the individual who's being abused most oftentimes feeling scared, confused, dependent, and insecure. So for those of you who don't know this, there are certain acts of intimate partner violence that don't rise to the level of criminal activity, which would be something like humiliating somebody, putting it down. But basically in Connecticut, if you assault, if you threaten, if you harass, you strangle, or you stalk your partner, then that is a crime. So go ahead to the next slide. And I just want to talk a little bit about COVID and what we're seeing with this. So now what is happening for us is that we have individuals that are now sheltering in place. So what that does is it creates some additional barriers to people seeking assistance. First and foremost, the reason being is because generally when we're working with someone and they're attempting to leave the relationship, what is happening for them is that oftentimes there's a window of opportunity for them to leave the relationship or to contact us for services. And unfortunately, due to the fact that people are, for lack of a better word, stuck at home with their partners, what we're seeing is that they're really is no longer any window of opportunity for people to get out of the relationship. So we're ending up having to be really creative with people when we're talking to them about opportunities for them to get out or to have a continued conversation with us about this. And then what's happening is that not only are they not able to get out, but they're experiencing what I would call increased isolation, which leads to increased risk because of the social distancing measures that we have had in place right now. One thing that I do want to say is it's not just the fact that people are in their homes with their partner who may be abusive, and they're experiencing that increased isolation, but we're finding that we have a number of people who have already left their relationship, have moved on, but what's happening for them is the fact that they are now socially isolated, unable to reach out. It's re-traumatizing them in a way that's similar to if they were in this domestic violence relationship as well. So we see a number of people that are calling us, and it's not so much that they're trying to get out of the relationship or anything, but the feelings that they have about being isolated, about being forced to stay in their home, are similar to what they experienced when they were in their abusive relationship. What we're also finding is that people are more vulnerable to economic insecurity. They're more vulnerable to health insecurity. And we see that there's additional insecurities that they're facing now because their partner is controlling what's going on in the home. So for some people, if they're either working in place at home now, then they're still faced with that increased isolation. If they're not, it's possible that for some of those people, they have lost their jobs, which makes it that much harder for them to try to leave if indeed they are leaving the relationship. But the one thing that I also want to say is, for any of you who are out there, and it doesn't matter how it is that you're having contact with these individuals that you work with. It could very well be that you're doing it via telehealth or telecounseling. It could be that you're driving by. It could be that you're social distancing. So one of the things that I think is particularly important, and we're finding this regardless of who the audience that I speak with is that it's very, very conceivable that right now you yourself are the only people that are having contact with the individuals you work with. So it's not as though somebody who may be experiencing homelessness or domestic violence, or homelessness due to domestic violence, has a plethora of outside organizations that they're having contact with right at this particular time. It very well could be that it's only you are the only trusting relationship that they have right now. So that's why I think it's equally important for people to recognize that when you're talking with somebody, if you're the only person that they're having contact with, that you can assist them in getting to us as well. And so go ahead and flip the slide. But before I even want to talk about what it is that you can do and what it is that we're asking people to do on our behalf, I think there's a couple of other things that are important to understand. So what's happening is that we have decreased courts. We have decreased court hours nowadays. What we're finding with the law enforcement response to intimate partner violence is that if indeed they are going out to homes to investigate disputes or calls for domestic violence, oftentimes if they're actually making an arrest, some of the charges are lesser charges than we would normally see on any one given day when we were out and functioning in the world. And part of the reason for that is because they don't want to be holding individual arrestees because of COVID-19. And so they want to be able to release them and send them back. And what's happening when they're sending them back after they've been arrested is oftentimes they're able to go back back to the home in which they just left or just were arrested from. And we're working on all of these. I think that we've just asked law enforcement that if possible, if you're going to release somebody, put some conditions of release on them so that they can't go back into the home and re-traumatize the individuals that live there. One of the other things that we're seeing is that, when we talk about COVID-19, it's not just in relationship to the adults that are in the house, but also the kids that are in the house as well. So we know that there's a pretty good correlation oftentimes between intimate partner violence and child abuse. And I would say, kind of just off the top of my head, if I were to query our member organizations, they would say minimally 60% of the individuals that they're working with have DCF cases as well. And so what we're seeing is that there's been a real decrease in referrals to DCF, primarily because nobody has eyes on a lot of these kids. And so what happens is that, if kids were in our services, if kids are in school systems, if home visitors and kids were in your programs as well, we would have eyes on them and we would be able to identify if we're seeing that that co-relationship between intimate partner violence and child abuse as well. And then just to get back to the kind of law enforcement piece of it, so now what's happening is that a lot of the courts have closed. I think last count that I knew, there were 6 courts open with very limited office hours. A lot of them are only open 2 or 3 days a week, and even at that, there's limited office hours in that sense. So the problem that we're seeing with that is that it's been increasingly challenging for us to try to reach out to victims when an arrest has been made, because we're trying to figure out which court the individual survivor is in, how can we contact them. But more importantly is that if somebody is seeking an order of protection, a civil order of protection, a restraining order, then what's happened is that that was almost virtually impossible. So I do want to say this, that when this started happening and we realized that people weren't able to go to the court for to seek a civil remedy with restraining orders, that we have negotiated with the judicial branch, and that people can file restraining orders or get assistance with seeking a restraining order right through Safe Connect. And I'll talk a little bit more after I ask you for your assistance. And so we're able to do that, and that we do have a mechanism now. I believe we've contracted with Lindsay Limousine, so that if people don't have transportation to go to court, then we can offer that as an option. We can offer a transportation option to them as well. And all of this stuff can get negotiated right through Safe Connect, which I will talk about in a second. So if you could just switch that slide for me, that would be great. So what we're asking everybody that we have, that we work with, that we have partnerships with, is that We have all started talking about intimate partner violence with all of our clients because irregardless of whether it was happening before, that increase putting two people together 24 hours a day sometimes exacerbates the relationship, and we know that it can happen. So because of that, we're asking everybody that we know just to go out and say, you know, we're asking people, we're just started talking about intimate partner violence because we want to make sure that everybody out there is safe. And we also want you to know that in Connecticut, we have a helpline. It's open 24 hours a day, 7 days a week, and it's called Safe Connect. And all of our Safe Connect advocates, they're clear, they understand complicated relationships, their services, all the services are free, safe, confidential, and voluntary. So if you know anybody who might benefit from these services, what's happened is that when we made the transition over to Safe Connect, we also added not just that it's a telephone helpline, but we have a live chat capabilities. We have email capabilities as well. We would have text. We don't have text now because everybody's working remotely, but under normal circumstances, we have text as well. Okay, go ahead. So what we're asking people to do is, if you are talking to people, educate your folks every time. If they want to talk to you further, because remember what I said previous to this is that it's conceivable that you are the only person that they have a trusting relationship right now. If they want to talk to you, what's a good time to talk to you, but remind them if they're using their phone to take it off speakerphone, and just tell people that we also have the live chat of Safe Connect, because it might be more feasible for somebody to email or to have a live chat with somebody than actually having a phone conversation where somebody can hear us. And it's not required that you give your name when you contact, and regardless of how you contact Safe Connect, it's not a requirement that you give your name. You can just come in anonymously. You can make up a name. It's less important to us that we get your name. It's more important to us that we can help you in that way. So if you can change that. And I think the most important thing that I try to tell people is, because more oftentimes what intimidates people about just talking about intimate partner violence and talking about it is that everybody feels like they have to be the expert, and we're just asking you as a part of, you know, our overall big huge community safety net that you don't have to be experts. If you want to become more expertise in it, I can help you with that, but just get them to us, and if you can just get them to us. So okay, so I want to give you a little bit more detailed information about Safe Connect. So in November, and some of you, and I think a lot of you have, who are out there today, have relationships with your local domestic violence provider, wherever they are. But probably halfway through last year, what we were finding is that a lot of the folks that were working in our domestic violence organizations were spending all of their time answering the hotline, and they were actually asked to be kind of double duty, probably triple and quadruple duty, and you know how that is. But more oftentimes it would be the hotline was in the shelter, so they were expected to answer the hotline. They were expected to work with, advocate for the clients in the shelter, and so they weren't always able to give their 100% focus in either one of these lands in that sense. So what we did was we decided to bring our all of our hotline services in-house at CCADV, and so we formed what we call Safe Connect. So Safe Connect is open 24 hours a day, 7 days a week. And right now, like I said to you before, we have phone capabilities, we have email capabilities, as you'll see on the slide there, and we can also chat with you in your language. So what happens when somebody calls Safe Connect is that Safe Connect will act as the triage service. So what we're going to do is try to learn a little bit about what's going on with somebody. How is it that we can help you? Because for some people, it's not that they need shelter. They might just have questions. They might need a resource. They might need a referral. And so what we're trying to do is take that off the plates of our domestic violence agencies. So what happens is that they can concentrate on the 100% of the provision of the services. So generally what happens is they'll ask questions, they'll try to understand what's going on, they'll weigh out options with people that are in need of services, and then try from there to move them to the appropriate services that they need. And the one thing that I want to say about Safe Connect, and you can change the slide for me, please, is that we have the capability of, we have the ability to communicate in almost 200 languages. I will say that our Safe Connect staff is a staff of, I would say, between 35 and 40 people. I don't see all of them at one time, but with the exception of 3 people that work in Safe Connect, every other person speaks more than one language. So we have a range of languages, of course, Spanish being the first language, but we have a variety of Asian languages, just a whole host of languages that people speak. And because of that, I think you can be fairly confident that if somebody has limited English proficiency, that we'll still be able to effectively communicate with them. So if we have this rare language that one of our 35 advocates can't speak, then of course we would move to language line. But really what they do is they're going to try to meet that individual where they're at, try to assess their situation, help them put out a range of options for them, and then go from there. So I do want to say a couple things, although I think that for most of you, you do understand that and I think this is the important thing. I don't necessarily need to tell you, but I think it's important to relay this information to those individuals that you're working with, is that we're not connected to DCF, so it's not a mandatory reporting opportunity for us. We're not connected to law enforcement, so that people don't have to fear that if they contact us, then we're going to automatically reach out to DCF, or we're automatically going to be calling law enforcement, because that is not the case. And I'd also like to say that in terms of the work that Safe Connect does nowadays, is that it's not just for you, it's not just out there for survivors and people who are needing assistance. If you have questions, if you need resources, anything that you might need as well, even if you're working with somebody and you just have a question about, well, did I think of everything? Was there something I could have said or done or whatever? Those advocates are out there and readily available to answer your questions as well. Okay, go ahead. So, but having said that, because I think that there's a lot of confusion about that once we made the changeover to Safe Connect, is that I would say this to you. If this is a new individual that you're working with, so it's a new it's a new client, it's a new consumer that you have out there, I would go through Safe Connect. But you may already have some established relationships where you have already had contact with the local domestic violence organization in your area. So if you have been working with somebody for a while and they have been hooked up to the local domestic violence agency, you can continue in that process. And then for anybody who might be new to you, I would go right through Safe Connect. So I think the thing about Safe Connect is, like I said before, they're more of the triage services. They're helping people to, if we look at kind of in a way like housing navigators and that kind of thing, that's their function in that. They navigate where people should be, help them to get to those places. But in terms of your shelter, your advocacy, your counseling services, your individual groups and that kind of stuff, that's still going to take place at your local domestic violence agency. And you can see on the right here, we've listed all of the services, the counseling, the support groups, the core advocacy, lethality assessment, safety planning, all of that still gets taken care of by the local domestic violence organization. Okay, if you can, okay. So I just want to let you know that, help is available. Like I said, we're there 24 hours a day. I'd be happy to answer any questions that you might have right now. I think I just wanted to take an opportunity, and thank you, Liz, for inviting me here today, just to really get to talk about like what it is that we're out there, what it is that we're doing, how you can connect up your folks, and then some of the little variations of things that we're finding because we are in the middle of this continued kind of pandemic.
Linda, you did a great job of just jam-packing so much information into a short period of time. I want to sort of underscore one of your slides, which is having sat through a 15-minute presentation does not make any of us experts in this field. The takeaway is to make sure that folks connect to the hotline or connect to CCADV. Also just want to remind folks that through both the Balance of State, COC, and Opening Doors, Fairfield County, we've received rapid rehousing funds specifically earmarked for folks leaving domestic violence. Annie Stockton-Sabrowski's on the call with us. She's the point person who's been processing all of those applications to act to get folks into their own places safe and away from harm's way. So hats off to CCADV and to Linda. I just want to move us along and say that Alana Cable from HUD is on the call with us. Alana, how are you? Welcome.
I'm good, John. Thank you very much. Good afternoon, everyone. I hope you all continue to be well and safe. I have some CPD HUD Community Planning Development updates for you this afternoon. I hosted an all Connecticut Entitlement Grantee Conference call with our 23 entitlement grantees during this past week in order to explain to them how to apply and submit to HUD for the CARES Act grants. HUD has reserved the first tranche of the CPD CARES Act funds, so grantees may begin to apply to us for them as soon as they are ready to do so. And we have a number of waivers in place to reduce the public comment period, allow for virtual public hearings. Our Acting Assistant Secretary, John Gibbs, also released a memo on May 4th, urging states and localities to apply for their ESG and HOPWA CV funds as soon as possible. I also sent the entitlement grantees the interim ESG CV certs. There's one set for states and there's one set for entitlements. They are up on the HUD Exchange via the link that has all of the certs, and I can send that out to any of you who might need it. But it's important that our entitlement grantees be sure to use the interim ESG CV certs because there have been some changes made to them to coordinate with the CARES Act funds. So for example, you'll see on the interim ESG CV certs, the match component has been X'd out. That's because it doesn't apply to the CARES Act grants. The major rehab conversion certs, there's also additional information there with regard to the CARES Act. As you know, the regular major rehab conversion certs will not apply for the CARES Act funding that's used to provide temporary emergency shelters. You know, someone might be leasing existing properties, setting up a temporary structure or something like that to prevent, prepare for, and respond to coronavirus. So we urge our ESG entitlements to be sure to use those interim version of the certs when they apply, at least for this tranche of funds. The certs will be finalized when HUD releases the program notice. Grantees, as you know, I think I've talked about this before, in Connecticut, they have two options to apply to HUD for their CARES Act funding, for their CARES Act CPD funds, that is. They're either going to amend their existing FY 2019 annual action plan, or they are going to incorporate it into their FY 2020 consolidated annual action plan. And speaking one-on-one with all 23 of them over the past couple of weeks, I know we have a mix about to happen in Connecticut. We have advised them all that the quickest path to approval is amending their FY 2019 annual action plan. We at HUD have an expedited review process in place. So if all is in order when the grantee applies, they should receive their grant agreements from our office fairly quickly after they've submitted the request for the funds. If, on the other hand, grantees are incorporating their CARES Act funds into their FY 2020 consolidated annual action plan, we do statutorily have up to 45 days to review that plan. Obviously, my team will strive to review them as quickly as possible, but it's important for everyone to understand that consolidated plans are much more involved than reviewing an action plan. We only receive consolidated plans once every 5 years, so it does take the team time in order to do that properly. By and large, the vast majority are amending their FY19 annual action plans, but I do have some that are incorporating it into their 2020 consolidated annual action plan. Just some other updates for you. I did receive environmental review, CPD, CARES Act grants, advice and guidance relative to CDBG from our environmental review officer. On the CDBG side, and note, I've sent her a request to confirm whether or not the same standard will apply for ESG and HOPWA CV grants when new environmental reviews are necessary. But with regard to CDBG, in order for an activity to be eligible for reimbursement with CDBG CV funding, the environmental review would have to have been completed prior to undertaking the activity. This is the ruling from the headquarters Office of Block Grant Assistance Program Council. So obviously it's a bit frustrating for all of us, but it is a statute. It wasn't one that was addressed with the CARES Act, so it is what it is. I have, however, asked her for confirmation on both the ESG CV and the HOPWA CV side, and I'll let you know when I receive that. We don't yet have formal HUD advice and guidance on duplication of benefits. However, I did send out to the entitlement grantees earlier this week a webinar that's up on the HUD Exchange with regard to our disaster recovery program. There's a 2019 duplication of benefits webinar. I sent them the questions we have in the checklist for duplication of benefits relative to DR. You know, keep in mind this isn't our formal advice and guidance, but at least it gives them some sense of what we might be looking for with regard to duplication of benefits. So hopefully, I know headquarters is expecting to get that notice out very shortly, and we will send that out as soon as it's available. So that's about where we are. We're hoping to receive some applications shortly. I know some grantees are ready to go, so we're looking forward to moving the funding through the system.
Great, thanks so
That's
much,
it for me.
Linda. That is such great news, and I know I say it every time you're done speaking, but we're so grateful that you are with us at the Hartford field office and that your team is partnering with us to get this money out the door and to keep us on the right side of the law and all of that good stuff. So make sure that you give our best wishes to your team next time you talk to them.
I will certainly do that. Thank you.
So we're coming up to the end of our hour together. I'm gonna put my Darth Vader hat back on. And just the next slide, remind folks that we are back at our regularly scheduled time at 11 o'clock so that we can do our 12:30 steering committee meeting at 12:30. Also want to just sprinkle this little thought to you, which is that coming up on the agenda for the CT BOS COC is the voting for the tri-chairs. So if any of you are interested in trying to herd all of us cats together and get our work done within an hour, we certainly encourage you to throw your hat in the ring. Otherwise, Steve DeLella, Alice Minervino, and myself, you'll be stuck with us for another year. But we do want to let you know that we'll be talking about that at the steering committee for a vote that will happen in June. Just a reminder that we have just more information than any of us can digest, but if you have a specific question, those are the resource links that you can click on right through your PowerPoint presentation, and that our great folks at Housing Innovations continue to support us through thick and thin. And I know that there have been some questions that were put in the chat room that we don't have answers to. They'll get on it. If there's an answer out there to be found, we will find it for you, Susie. And I think any parting words from our friends at Housing Innovations?
No, just everyone have a good weekend, have some rest.
Be kind to yourself, be good
Kind
to yourself. And others.
yeah.
Absolutely. Okay.
Thank you, Linda. I just want to say that. Thank you,
Linda.
Thank you.
Great job.
Wonderful.
Okay, everyone.
You're welcome.
Use your little clap hands in the reaction.
Oh, we can do that in chat. Remember?
We can do that in chat?
We can. It's one of the emojis.
Yes, yes, yes. There, Linda, can you see us clapping?
Oh, I can. Thank you so much.
Yeah.
Thank you, Linda.
It was a pleasure. It was a
Well,
pleasure.
Since we haven't run out of time, John, I privately messaged Linda to check if staff could call Safe Connect when they were with a client to support them and have a three-way conversation, and she said absolutely yes.
Great.
Yes.
Great.
Like I said, and I really appreciate what you said there, John, about people not having to be the expert. All you got to do is get them to us, and I did say that if people have rapid rehousing questions, go ahead and you can contact Annie Stockton-Sabowski at our office too.
Great. All right. See y'all next week, everybody. Bye.
Thank you. Bye-bye.
Thanks.
Thank you.
Have a
Bye.